Let's discuss Chinese and Western medical thought, illness and its causes in TCM theory. We should distinguish between disease and illness. The term disease, as it is understood by Western medicine, is definable as a disorder with a specific cause, which may or may not be known, and recognizable signs and symptoms. It is therefore what the doctor diagnoses the patient as having. On the other hand, as Lloyd suggests, illness is what the patient feels. Illnesses, therefore, form a separate universe that intersects with disease. There are illnesses like the chronic fatigue syndrome that would not normally be treated as diseases. There are diseases like hepatitis B for which the carrier have the virus but do not manifest any symptoms of hepatitis and do not feel ill. The crude form of the etiological standpoint would treat all illness as diseases or perhaps as chimeras, as some doctors regard chronic fatigue syndrome. Although, as I pointed out earlier, the etiological standpoint cannot properly incorporate illnesses for which there is no necessary or sufficient cause. Chinese medicine, like much of the ancient Greek and Galenic medicine, has traditionally been more focused on the condition of the human body when it falls ill rather than on disease and its cause. In most TCM contexts, it would be more appropriate to refer to the patient's illness than to her disease. TCM theory regards the fundamental factors that lead to illness as being either external climatic factors like the heat, cold, dampness, wind, dryness, or internal emotions, excessive pleasure, anger, sadness, fear, and excessive contemplation, as well as accumulated products of these factors like the phlegm and blood stasis. Even though modern TCM physicians are adequately schooled in microbiological sciences and are aware of the role that viruses, bacteria, and cellular disorders play in disease, this does not change their adherence to the principle that the fundamental causal factor are climatic and emotional factors and their byproducts. Example of two common diseases that the common cold and cancer serve to illustrate this point. Let's discuss the common cold. What causes the common cold? As told by a virologist friend that he was running a cold because he had caught a chill, the implication being that it was caused by a chill. The virologists disagree and pointed out that the cold was caused by a virus, not by a chill. When asked where the virus had come from, he said that it was in the air and could be found everywhere. But why he had caught a cold while he had not? He thought it might have been working too hard and the immune system was down. Since he caught the cold because of the immune system was down, he argued that the immune system was down because he had been working too hard, or would not say that working too hard and a weakened immune system were the real causes of the cold rather than a viral infection. The virologist was focused on the viral etiology of the common cold, while he focused on the environmental and internal physiological factors. Both of them were guilty of what Lewis termed individuous discrimination, each singling out a decisive cause of the cold and leaving the other as causal conditions. The virologist saw the rhinovirus as the cause of the common cold and the weakened immune system as a contributing condition. However, as a person interested in improving the health and fitness of people, he was biased towards the holistic picture of internal body balance and the chill that broke the back of the immune system. He saw the presence of the rhinovirus in the human body as the definition of the common cold, not its cause. As there was nothing that could do to prevent people from being exposed to the virus. The value of medical efficacy led to look for causes that would manage or manipulate. The search for prevention of colds would thus focus not on the virus but on dietary, exercise, and hygiene factors that could be managed. The clinical trials that would advocate for the study of causation of cold would therefore involve these causal factors. Thank you for your attention.
We continue with interviewing techniques. This time we discuss stools. Inquiry about the stool includes the stool's regularity, consistency, and smell, and whether there is pain associated with passing of the stool. Something that ought to be fairly straightforward and easy to get concrete answers about can sometimes be surprisingly difficult because many people are not very conscious about their stools and can only provide vague answers. It is also important to define for a patient what regular bowel movements are. Once a week is technically regular, and so is 6 times a day, but both cases are signs of severe imbalances. Once to twice a day is considered normal, and less or more often than that is an expression of an imbalance. The consistency of the stools can deviate from normal by being watery, sticky, or dry. Constipation is when stool movements are less frequent than once daily. Knowing that a person is constipated is not enough. It is also important to ascertain the consistency of the stool and whether there is pain associated with passing the stool. Acute constipation can be due to an invasion of exogenous pathogenic qi. This will either be a direct invasion of cold in the intestines or excess heat from an invasion of exogenous pathogenic qi penetrating down to the yang ming aspect. If the invading pathogenic qi is hot, the stools will dry out and the abdomen will feel tense. If the invading pathogenic qi is cold, the stools will not be dry. There will be cramping pain and the abdomen will feel cold on palpation. Apart from excess heat, yin deficiency and blood deficiency can cause the stools to be dry due to a lack of fluids. The difference between deficiency and excess conditions can be determined by whether there is pain or bloating, which will occur in an excess condition. Liver qi stagnation can also result in the stool not moving freely and smoothly through the intestines. Therefore, the stools will typically be pebble-like, similar to goat droppings. If qi stagnation has generated heat, the stools will also be dry. Qi stagnation can cause the movement of the stool to be sluggish, taking a long time to pass through the intestines. There may well also be pain, tension, and bloating in the abdomen when there is qi stagnation. This will be alleviated by the passing of the stool. It is important to remember that the stagnation of qi in the intestines is not always due to liver qi stagnation. Liver qi stagnation can also manifest with alternating constipation and normal or loose stools. Spleen qi deficiency can be indicated by stools that are long and thin, like a pencil. The stools will have an otherwise normal consistency. Yang deficiency constipation will also manifest with a stool that has a normal consistency, the constipation arising from a lack of yang movement in the intestines. The stool will take a long time to pass through the intestines, and the person may feel exhausted and sweat after passing the stool. Lang qi deficiency can also manifest with exhaustion and sweating after bowel movements. Again, the person lacks the strength to transport the stool downwards through the intestines. The effort of passing the stool will weaken the person's qi so much that they will feel exhausted and the lung will temporarily lose control of the pores, resulting in spontaneous sweating. So constipation, dry stools, abdominal tension, and pain signifies excess heat. Constipation, compact stools, abdominal tension, cramping pain is excess cold. Small lumpy stools, stools that resemble goat droppings, signify liver qi stagnation. Long loose stools, not hard or dry, indicate spleen qi deficiency. Dried stool, the abdomen does not feel tense or tight, blood deficiency, yin deficiency. Fatigue after defecation, lung qi deficiency. Sluggish stools, Qi stagnation, Yang deficiency. Constipation in a woman who has just given birth, blood deficiency. Alternating constipation and loose or normal stools, liver Qi stagnation. Conditions that are better after defecation, excess conditions. Conditions that are worse after a bowel movement, deficiency conditions. Thank you very much for your attention.
Let's continue our discussion on the invasion of exogenous wind as part of our topic, diagnosis according to pathogenic Qi. The symptoms and signs of specific endogenous wind pattern are the following. In wind cold, there is aversion to cold and wind, chills, headache, stiffness in the shoulder and neck, lack of sweating, coughing, sneezing, clear secretions from the nose, slight or no fever, itchy throat, no thirst, superficial, tight, and slow pulse. In wind heat, there is less aversion to cold than when there is wind cold. There will be chills, mild or high fever, thirst, red eyes, red and sore throat, yellowish secretions from the nose, cough, possibly with yellowish sputum, superficial and rapid pulse. The tongue may have a red tip or a yellowish coating. In wind damp, there is itchy skin disorders, skin diseases where there is swelling and aversion to wind and cold, heaviness in the arms and legs, heavy and painful muscles and joints, slight or no fever, superficial and slippery pulse, in a wet tongue. In wind water, there is acute edema, especially in the face and around the eyes. Cough with various watery sputum, wheezing, no thirst, superficial and slippery pulse, and a wet tongue. In wind dryness, there is dry throat, dry lips, dry mouth, dry eyes, dry skin, dry mucous membranes, dry tongue, and a superficial pulse. In wind B, this is a B syndrome where wind, dampness, and cold have invaded the channel or the joint. Wind is the predominant of the three pathogenic Qi. There will be painful joints. The pain will be provoked by the wind or by drafts. The pain can migrate from joint to joint, be erratic, and change character. Sometimes sharp, sometimes probing, sometimes numb, sometimes heavy, and so on. The pain can come and go very suddenly and will mainly affect the upper part of the body. There will often be aversion to wind, cold, and drafts. There may be a slight fever and sweating. The pulse will be superficial. In invasion of wind cold in the face, wind cold can invade the channels in the face. It will often be the Yangming channel that are affected. The invasion of wind cold in the face will result in pain and especially paralysis of the facial muscles. The pulse will be superficial and tight. For the treatment principle, we expel wind. In our acupuncture treatment, we can choose from the points UB10, UB12, LI4, lung 7, DU14, DU16, Sanjiao 5, and GB20. If there is wind cold, we can add SI3 and UB62. If there is wind heat, add LI11. If there is wind dampness, add spleen 6 and spleen 9. If there is wind water, add spleen 9 and ren 7. If there is wind dryness, add kidney 6 and spleen 6. If there is wind B, add local and distal points on the relevant channels. If the invasion of wind is in the face, add local and distal points along the channels. With needle with draining technique, moxa and caps are recommended. So for further explanation, UB10, UB12, LI4, lung 7, DU14, DU16, Sanjiao 5, GB20, activate Wei Qi and expel wind. UB62 and SI3 expel pathogenic Qi from the Tai Yang aspect. Li11 expels wind heat. Spleen 6 transforms dampness, drains water, and can nourish Jinya and Yin. Spleen 9 transforms and drains dampness and water. Kidney 6 nourishes Yin and Jinya. Invasion of wind can be caused by Qi deficiency, and its resulting pattern will depend on the individual pattern. Thank you for your attention. When there is an acute invasion of exogenous pathogenic qi in the exterior, it is advisable to consume drinks that are spicy and diaphoretic to open the exterior and expel pathogenic qi. This could be ginger, garlic, whiskey, brandy, and chili if there is an invasion of exogenous wind, or mint, chamomile, elderflower if there is an invasion of exogenous wind heat. It is also advised to abstain from eating or to only eat soups, for example, such as onion soup. There are two reasons for this. First, when temporarily fasting, qi will not be used to transform food and therefore can be used to combat the invading pathogenic qi. Second, some sources say that the downward movement of food and qi in the stomach can draw the exogenous pathogenic qi inwards from the surface. Similarly, the sour flavor should be avoided due to its astringent or centripetal dynamic. Vitamin C, lemon, and other things that are very sour should not be consumed during an invasion of exogenous pathogenic cold, as they will draw pathogenic cold inwards while closing the pores in the skin and thereby preventing the cold from being expelled again. This also means that antibiotics are not recommended at this stage as they are cold and drain downwards. It is important that the person protects themselves from drafts and exposure to the elements. Invasion of wind can be caused by Qi deficiency, and its resulting pattern will depend on the individual pattern. Thank you for your attention.
Let's discuss diagnosis according to 12 regular channels. The treatment of channel problems, part 3. The kidney channel imbalances. For the symptoms and signs, there is pain, weakness, or tenderness along the course of the kidney channel. There is skin and tissue changes along the course of the channel. There is lumbar soreness, sore knees, sore ankles, sore feet, dry throat. For the acupuncture treatment, local distal and ashy points of the kidney channel, possibly combined with UB58. Next, the pericardium channel imbalances. For the symptoms and signs, there is pain, weakness, or tenderness along the course of the pericardium channel. There's skin and tissue changes along the course of the channel. There's cardiac pain, chest pain. For the acupuncture treatment, local distal and ashy points of the pericardium channel possibly combined with Sanjiao 5. Next, the Sanjiao channel imbalances. For the symptoms and signs, there is pain, weakness, or tenderness along the course of the Sanjiao channel. There's skin and tissue changes along the course of the Sanjiao channel. There is sore eyes or eye pain, red eyes, ear pain, deafness, exudation from the ears, sore throat, stiffness and pain in the shoulders, elbow pain, alternating fever, and chills. For the acupuncture treatment, local, distal, and ashy points on the Sanjiao channel, possibly in combination with pericardium 6. Next, the gallbladder channel imbalances. For the symptoms and signs, there is pain, weakness, or tenderness along the course of the gallbladder channel, especially when there is pain or soreness of the eyes, ears, jaw, the side of the head, the neck, shoulders, hip, the side of the ribs, and the side of the legs. There's skin and tissue changes along the course of the channel, hemilateral headache, red eyes, exudation from the ears, deafness, alternating fever, and chills. For the acupuncture treatment, local distal and ashy points on the gallbladder channel, possibly combined with liver 5. Next, liver channel imbalances. For the symptoms and signs, there's pain, weakness, or tenderness along the course of the liver channel, skin and tissue changes along the course of the liver channel. There's pimple or spots around the mouth up to or during menstruation, sores and ulcers around the mouth or the genitals, pain or tenderness in the groin, incomplete or difficult urination, genital pain or tenderness, impotence, permanent erection, abdominal pain, painful eyes, headache, leg cramps, lump in the throat. For the acupuncture treatment, local distal and ashy points on the liver channel, possibly combined with GB37. Thank you for your attention.
Let's talk about treatment principles, tonifying the upright chi and expelling the pathogenic factors. Tonifying the upright chi and expelling pathogenic factors includes 3 possibilities. First, tonify upright chi, then expel pathogenic factors. First, expel pathogenic factors, then tonify upright chi. Tonify upright chi and expel pathogenic factors simultaneously. First, tonify upright chi, then expel the pathogenic factors. This approach is used when there is a pathogenic factor to be expelled, but the upright chi is too weak to use a reducing method, as this would weaken it further. This situation is, however, rather rare and applies only to exterior patterns. When a very weak and possibly elderly person has been attacked by an exterior pathogenic factor, and upright chi is extremely weak. In this situation, it is not possible to expel the pathogenic factor, as the reducing method might further weaken upright chi. One can therefore first tonify upright chi and then expel the pathogenic factor. For example, if a very weak elderly person with chronic bronchitis has an attack of wind cold, one could tonify chi first and then expel wind cold. This approach, however, is seldom necessary and is not widely applied. It must be noted here that tonifying upright chi alone is not sufficient to expel the pathogenic factor. This approach does not apply to interior conditions, as in these cases, one can tonify the body's chi and expel the pathogenic factor simultaneously. Tonifying the upright chi before expelling pathogenic factors is used in interior and exterior conditions when the patient's chi is very depleted. It is a rarely used strategy. First, expel pathogenic factors, then tonify upright chi. This approach is suitable when there is a pathogenic factor and upright chi is weak, but eliminating pathogenic factor is called for due to the urgency or severity of the clinical manifestations. This approach is also used because tonifying upright chi alone can, in certain cases, also stimulate the pathogenic factor. This strategy is widely used in clinical practice, both in exterior and interior conditions. In fact, when there is a pathogenic factor and the body's chi is weak, this is the standard procedure to adopt, apart from a few rare cases already mentioned. It is important to stress that if the diagnosis and identification of patterns is correct and elimination of pathogenic factors is called for, eliminating pathogenic factors will not weaken the patient. We can expel the pathogenic factor first using the reducing method with acupuncture. Once the pathogenic factor is expelled and the excess type clinical manifestations have gone, only then can we tonify upright chi. This approach is applicable in both exterior and interior conditions, but particularly in exterior ones. When tonifying the upright chi, we should pay attention that there is no pathogenic factor left. In exterior patterns, this is generally the approach adopted. For example, if a patient previously suffering from deficiency of qi is attacked by exterior wind heat and has symptoms of fever, headaches, light sweating, aversion to cold, body aches, floating rapid pulse, correct approach should be to expel wind heat and release the exterior by reducing Li4, Li11, or TB5. When the exterior symptoms have totally gone, No fever, no body aches, no aversion to cold, no floating pulse. Only then can one tonify the upright chi. Tonifying the upright chi before the wind heat has been expelled can somehow stimulate the wind heat too and lead to a worsening of the condition. For example, the fever might rise. It is also important to pay attention to this point even when a fairly long time has elapsed after an exterior attack. In certain cases, if the exterior pathogenic factor is not expelled properly, it can penetrate the interior and lurk there for a long time after the initial attack. To continue with the previous example of attack wind heat, the person would find it difficult to recover from the attack, experience great tiredness, and become prone to strange recurrent sore throats. This would be due to some remaining heat lurking in the interior. In Chinese, this is called residual pathogenic factor. In these cases, it is important to be able to recognize it and clear the remaining heat before tonifying the upright chi, as normally one would tend to tonify the upright chi straight away, since the person would complain of great tiredness. Symptoms and signs of residual pathogenic factor after an exterior attack would be tiredness, feeling of heat, recurrent sore throats, red tongue with a thin yellow coating in the area between the tip and the center, the lung area, and a slightly rapid pulse. In this case, we could use points to clear interior heat, such as lung 5, Li 11, or Du 14. Thank you for your attention.
Let's continue our discussion on diagnosis according to Zhang organ patterns. For today, we discuss lung and spleen qi deficiency. Lung and spleen qi deficiency. The lung and the spleen create song qi and chen qi together. It is very common to see a combined pattern of lung and spleen qi deficiency where a deficiency in one of the organs will be instrumental in the creation of a deficiency in the other due to the resultant decrease in the production of qi. In its etiology, as described, this pattern will usually start with a deficiency of either lung or spleen qi, while the decreased production of qi and the resultant qi deficiency will lead to a weakening of the other organ. Otherwise, the etiology is the same as that seen in lung qi deficiency and spleen qi deficiency. Lung qi is weakened by poor posture, repeated or unsolved invasions of exogenous pathogenic qi, and excessive use of the voice. Spleen qi deficiency arises from consuming foods and beverages that are cold in nature and temperature, raw foods and beverages that create dampness. Eating too much at a time or too quickly will also strain the spleen. Excessive consumption of spicy food can weaken lung qi. The lung and spleen are affected by emotions such as sorrow, melancholy, worry, and pondering. Prolonged illness and overexertion of the body can weaken both lung and spleen qi because they then have to work harder to replenish the qi. So for the symptoms and signs, we have fatigue, loose stools, pale face, disinclination to speak, and the voice lacks strength. There's breathlessness, bloating after meals, feeling drowsy after meals, poor appetite or no appetite in the morning. There's slight cough, possibly with watery sputum, spontaneous sweating or sweating on light activity. There's weakness or fatigue in the limbs, craving for sweets, aversion to cold and drafts. The person looks tired and worn out, possibly slumped posture, excessively worries and speculates about things, difficulty letting go of thoughts. Pale swollen tongue, possibly with teeth marks on the sides or near the front. The tongue can also be sunken in the front third. There's weak pulse, especially in the right guan and tune positions. The key symptoms here are fatigue, loose stools, breathlessness, pale complexion, pale tongue with teeth marks, and weak pulse. For the treatment principle, we tonify lung and spleen chi. In our acupuncture treatment, we can choose from points lung 9, stomach 36, spleen 3, spleen 6, REN 12, UB 13, UB 20, and UB 21. We tonify these points and moxa can be used. For further explanation, lung 9 and UB 13 tonify lung chi, stomach 36, spleen 3, spleen 6, REN 12, UB 20, and UB 21 tonify spleen chi. The advice given for both lung chi deficiency and spleen chi deficiency is relevant here. The diet should ideally consist of foods that are slightly warming, both in temperature and energetically, and prepared, boiled, steamed, stir-fried, baked, and so on. And the diet should not be damp and phlegm-creating. Fresh air and breathing exercises will strengthen the lung. Both the lung and spleen will benefit from good posture and gentle exercise because they will support their chi mechanism. Lung and spleen chi deficiency can be caused by lung chi deficiency, spleen chi deficiency, invasion of exogenous pathogenic chi, and in turn can result to wei chi deficiency, spleen yang deficiency, spleen chi sinking, spleen chi not holding blood inside the vessel, stagnation of chi in the upper jaw, heart chi deficiency, phlegm, damp in the lung, food stagnation, damp, phlegm, blood deficiency, lung chi deficiency, heart chi deficiency. Thank you for your attention.
Let's discuss diagnosis according to 8 principles. Excess cold part 3. We have here the table, the differences between the interior and exterior cold. For the interior cold, there is no headache, while in the exterior cold, there is acute headache. There is pain in full organ in interior cold, while in exterior cold, there is skin and muscle joint aches. There is disruption of a full organ function in interior cold, while in exterior cold, no disturbance of the internal organs function. For the interior cold, it is attracted to warm, while exterior cold, aversion to cold and wind. There is normal perspiration in interior cold, while exterior cold, lack of perspiration. There's a bluish finger and toes in the interior cold, while exterior cold, there is normal colored finger and toes. There's no fever in the interior cold, while in the exterior cold, possibly a slight fever or fever sensation. For the interior cold, there's a deep pulse, while exterior cold, superficial pulse. There's a pale or bluish tongue with thick white moist coating for the interior cold. And for the exterior cold, the tongue is usually unchanged. For the treatment principles in the interior cold, we need to warm the interior, while for the exterior cold, the treatment principle is to expel cold from the exterior. Treatment principle, if there is interior excess cold, expel cold, warm the interior. If there is exterior excess cold, open to the exterior, expel wind cold. Acupuncture points. Point selection will depend on which organ or channel had been invaded by cold. If there is invasion of wind cold, Tayang stage, choose from SI3, UB62, UB10, DO14, DO16, GB20, LI4, lung 7, UB12, and UB13. If there's cold, B syndrome, choose from LI4, DO14, local and distal channel points, ASHI points. If there's stomach cold, choose from REN 12, REN 8, stomach 21, stomach 34, and stomach 36. If there's large intestine cold, choose from stomach 25, stomach 37, stomach 28, REN 6, and REN 8. If there's small intestine cold, choose from stomach 25, stomach 39, stomach 28, REN 6, and REN 8. If there's cold uterus, choose from REN 4, kidney 12, kidney 13, stomach 30, and UV 32. Needle technique, draining, moxa is recommended. Relevant advice, a person who has been invaded by exogenous cold will benefit from drinking hot ginger tea, a decoction of garlic or hot whiskey with spices. If they have interior cold, they can use cinnamon in their diet, drink ginger tea, and use warming spices, as well as avoiding food and beverages that are energetically and physically cold. For the differences, we have here the differences between deficient and excess cold. There is symptoms. The symptoms are usually chronic for the deficient cold. For the excess cold, the symptoms are often acute. The person freezes, but if they put on enough clothing or lie under a kilt, they can keep warm for the deficient cold. And for the excess cold, the person freezes and cannot get warm even if they put on enough clothes and blanket. There's dull and pale facial color for the deficient cold. And for the excess cold, shiny white facial color. There's a milder symptoms for deficient cold, and there is a stronger symptom for excess cold. There's dull pain that is alleviated by pressure for the deficient cold, and for the excess cold, biting or cramping pain that is aggravated by pressure. For the deficient cold, if there is diarrhea or constipation, any discomfort or pain is not alleviated by passing of stools. While in excess cold, if there is diarrhea or constipation, any discomfort or pain is alleviated by passing of stool. There's a weak, deep, and slow pulse for the deficient cold. For the excess cold, there is full, tight, deep, confined, and slow pulse. There's thin white tongue coating for the deficient cold. For excess cold, there is thick white tongue coating. For the treatment principle, we have to warm the young for the deficient cold, and for the excess cold, the treatment principle is to expel cold, warm the interior. Thank you for your attention.
We will discuss blood stasis obstructing the mind as a pattern for depression. Clinical manifestations: depression, mental restlessness, agitation at night, short temper, restless sleep, dreaming a lot, pain in the chest. Tongue is purple, pulse wiry. Blood is the residence of the mind and ethereal soul, and the deficiency of blood frequently affects both the mind and the ethereal soul, depriving them of their residence. However, it is important to note that blood stasis also affects the mind and the ethereal soul. In particular, blood stasis tends to obstruct the mind in a similar way that phlegm does, and in serious cases, it can lead to a certain loss of insight. The patient is depressed but also anxious and agitated and may dream a lot, as blood stasis frequently causes an aggravation of symptoms at night. Remember, not only blood deficiency, but also blood stasis affects the mind, or Shen. The pattern of blood stasis obstructing the mind is more common in people over 40 and in women. It is usually due to long-standing repressed anger, worry, or guilt. Treatment principle: invigorate blood, calm the mind, eliminate stasis. Points: P6, bladder 17, spleen 10, REN 14, heart 5, spleen 6, liver 3, GB 15, DO 20. All needled with reducing or even method, except for DO 20, which should be reinforced. P6 invigorates blood and affects the upper burner and therefore the head. It also calms the mind and regulates coming and going of the ethereal soul. Bladder 17 and spleen 10 invigorate blood. Both these points invigorate blood and they are often used together. as the former invigorates blood in the upper burner, the bladder 17, and spleen 10 in the lower burner. Ran 13 and heart 5 invigorate blood in the heart, and therefore calm the mind when this is agitated by blood stasis. Heart 5 invigorates blood by virtue of it being the connecting point. Spleen 6 and liver 3 calm the mind and invigorate blood. GB 15 has a deep effect on the emotional life and is particularly indicated to balance the moods when the person oscillates between periods of low spirits and periods of elation. This point is effective to stop obsessive thoughts and pensiveness. And finally, do 20 lifts the mood. Thank you for your attention.